Now, in the first section of our lecture, Endocrine and Neurological Complications, let's start with very important topic, which is diabetes mellitus. In this section, we will talk about what are the effects or implications of diabetes on the pregnancy, and then how pregnancy affects the diabetes if patient has pre-existing diabetes and they get pregnant. So implications both ways, one on the pregnancy and then effect of pregnancy on the disease, and then how we can manage the diabetes during pregnancy. So diabetes mellitus in pregnancy, it can complicate pregnancy either because women has type 1 or type 2 diabetes mellitus before pregnancy, or because impaired glucose tolerance developed during the pregnancy. So both things can happen. Pregnant women might get pregnant and she has already type 1 and type 2 diabetes. Type 1 is insulin-dependent diabetes. These patients require insulin to control their blood glucose level. And then type 2 is patients who need oral anti-diabetic drugs. So both type 1 and 2 patients, once they become pregnant, how we can manage and what are the effects of diabetes on the pregnancy. In the other case, it's known as gestational diabetes mellitus. Gestational diabetes is the diabetes that occur during the pregnancy. These females have no previous history of diabetes mellitus type 1 or type 2. And they show impaired glucose tolerance, and once their urine glucose is done routinely on each antenatal visit, so when it is performed, they have high glucose level, and then later on when further tests are performed, they have high blood glucose level. So that's gestational diabetes mellitus. And diabetes mellitus is increased level of glucose in the blood as a result of maybe decreased production of insulin or resistance of insulin. So both can occur. So diabetes in mellitus in pregnancy, 2 cases. One patient might have it before coming pregnant, and then it can occur during pregnancy. Gestational diabetes. Why patients who have no history of diabetes can have gestational diabetes or high blood glucose level during pregnancy? Because there is mainly because of 2 reasons. One, there is defective or insulin secretion, decreased secretion of insulin. Insulin is hormone produced by pancreas. So decreased secretion of insulin can lead to hyperglycemia or increased glucose in the blood. Or there may be resistance of organs or to the insulin. So insulin resistance develop, and then insulin is not, although it is produced in normal amount, but tissues are not responding to insulin. There is resistance to insulin, and both these conditions can lead to hyperglycemia, increase in the glucose level in the maternal blood. Now, this increased blood glucose in the maternal blood goes to the fetus through placenta, and then here in the fetus, what happens now as a result of increased blood glucose, this causes increased secretion of insulin in the new fetus, and it also accelerates growth and deposition of fat or adipose in the fetus. And this increased deposition of fat or increased growth of tissues leads to increase in the size of the fetus. So usually the fetuses in the mother with high blood glucose level, they are very big, They are oversized, overweight, and very hard to deliver also because of their big size normally through vagina. So that's how it affects. Gestational diabetes, decreased production of insulin or increased resistance to insulin both cause increased in the glucose level in the blood of the mother. This increased glucose, when goes to the fetus, it causes increased production of insulin to lower that high glucose level, and also cause accelerated growth and increased deposition of fat and adipose. So that's how the gestational diabetes is. Then implication of pregnancy on disease, same as I mentioned in the previous slide. If there is increased in the production of we have decreased production of insulin and increased resistance to insulin also. And then another factor that's important during pregnancy, because in the pregnancy the placenta produces hormones like estrogen, cortisol, and human placental lactogen. So these are the three hormones: estrogen, cortisol, and placental lactogen are produced by the placenta during pregnancy. Now, what happens with these increased production of hormones? These hormones inhibit functioning of insulin and blood glucose level is increased. So same, it is because of decreased production of insulin during pregnancy. And now we know why this decreased production of insulin occurs, because there is production of hormones by the placenta that causes decrease in the production of insulin. This decreased production of insulin causes hyperglycemia in the mother. It acts on the different organs, liver, pancreas, and then causes decreased production of insulin. Decreased production of insulin then causes hyperglycemia, and this increased glucose level, when goes to the fetus, produces different effects like increased secretion of insulin in the fetus and also deposition of fat. So all this occurs in the pregnancy, and that's why a lot of females who don't have history of diabetes, they can develop gestational diabetes or diabetes that's present during pregnancy. Although these women are at risk of developing diabetes later on in life, but they had no previous history of diabetes. Larger insulin requirement, and then vomiting in early pregnancy, reduce warning signs of hypoglycemia. So pregnancy, implication of pregnancy on disease also, since the lot of women who are in the early pregnancy, they have morning sickness, they have lot of vomiting. So as a result of this early vomiting or early symptoms of pregnancy, it reduced the warning signs of hypoglycemia. It's hard to diagnose the hypoglycemia initially. Accelerate progress of complications. So increased larger requirement of insulin during pregnancy is there, because there is decrease in the production of insulin as a result of the hormones produced by placenta. There is vomiting in early pregnancy, reduced warning signs of hypoglycemia, and complications are progress very rapidly during the pregnancy. Complications of diabetes progress rapidly. Next, risk of pre-existing diabetes in pregnancy. So if the mother who gets, or the female who gets pregnant and she has pre-existing diabetes, this pre-existing diabetes has serious implications both on the mother and the baby. So implication on the mother are usually worsening of any existing kidney, eye, heart, or nerve problems caused by diabetes. So there is worsening in the complications of pregnancy during complications of diabetes during pregnancy. So there is worsening of complications in pregnancy of diabetes. Onset of labor is early, so preterm labor is common. Bladder and other infections are common. Lot of infections, they are more serious in pregnancy. So with diabetes, especially bladder and UTIs are very common. Gum disease, injury from delivering big baby. Babies are big because of deposition of adipose tissue or fat. They are big and they are hard to deliver. C-sections are usually recommended for delivery. Blood pressure, high blood pressures are present, and as a result of high blood pressure, preeclampsia, which is high blood pressure and protein in the urine, they are common. So all these are the complications of diabetes on the pregnant women. So they have C-sections are common, preterm delivery is common. Complications of diabetes, they progress rapidly. High blood pressure and preeclampsia occur. And then what are the effects of diabetes on the baby? Birth defects like heart defects, major birth defects of the brain and spinal cord, miscarriages, stillbirth are common. Weight of the baby is big, so it's during the normal delivery. Injury to the nerve in shoulder is common. Broken collarbone is common. The clavicle is the collarbone. Then we have low blood sugar after birth because of high insulin secretion during in the fetus. Hypoglycemia occurs after birth. Jaundice, yellowness of the skin and eye, and then they are obese later in life also. So these are some complications of diabetes, pre-existing diabetes during the pregnancy. It affects both the mother and the baby, and in the baby congenital deformities, birth defects can occur which involve the heart. Then we have brain and spinal cord abnormalities. Because of the big size of the baby, normal vaginal delivery is usually not tried, but if it occurs, injuries are common to the nerves in the shoulder and to the collarbone. And then there is jaundice and hypoglycemia after the delivery. So all these are the common complications of pre-existing diabetes in pregnancy. Now, how we can manage the diabetes in pregnancy? Preconception counseling is important. Any women who have a history of pre-existing diabetes, she wants to conceive, it's important that preconception counseling should be performed, so they should be aware of all the complications that can be associated with diabetes mellitus. The monitoring of hemoglobin A1C less than 6.1 is important. Insulin, metformin, folic acid, high dose and low dose aspirin are recommended. No use of other medications like statin and angiotensin converting enzyme inhibitors. Tight monitoring of glucose level is very important. The glucose level should be maintained within the possible normal ranges with proper use of medications, diet, and exercise. It's very, very important to limit the complication or to prevent any complications that can occur. And regular monitoring is important, so there should not be any increase in the glucose level. Fetal assessment for any abnormalities is usually performed. Maternal assessment is also important to find out if there are any complications, if there is any increase in blood pressure, if there is any risk of having preeclampsia. Blood pressure should be very, very regularly monitored. And then any progression of any complications like complications involving kidneys in diabetes is very common. Any infections, fetal well-being and maternal well-being assessment is very important. Routine, regular checkups, tests should be performed to monitor the blood glucose level and to find out if it has any implications or not. So that was all about section 1, in which we talked about the effects of diabetes mellitus on pregnancy and effects of pregnancy on diabetes and how it can be managed so we can avoid the complications associated with diabetes mellitus. Thank you for watching sqadia.com.